Hi, I am Dr. Rasya Dixit from Dr. Dixit Clinic, Bangalore. I am a dermatologist in private practice from the last 18 years. We are all excited about getting treatments done to make sure that our skin looks its best, and what is better than doing a vitamin-based peel. So when we talk about chemical peels, most of the people are very reluctant to get a chemical peel done because they are thinking the chemical is going to damage the skin. So we have come up with this concept of vitamin peel. And the vitamin that we commonly use is a combination of vitamin C and a combination of vitamin A. As we all know, the vitamin C is very good for the skin. It increases the luminosity in the skin. It makes sure that it fights the damage of the sun on the skin and tightens the pores. And retinol, as we all know, is going to exfoliate the skin. It's going to give a more clear, acne-free skin. It's going to tighten the pores, and it is going to increase the collagen. So this is a combination of epidermal treatment where you're getting the glow as well as the improvement from the sun damage with vitamin C, and you're getting a deep treatment by improvement of the open pores as well as improving the collagen with the vitamin A. This is a vitamin peel. So how is this treatment done and how is it different from the routine chemical peel? Vitamin A peel is usually a leave-on peel. Routinely with regular chemical peels, we neutralize the peel. So the peel is applied and then it is neutralized either with water or like a neutralizer solution immediately, and then you leave the clinic. But in a vitamin peel, it's a leave-on treatment. The vitamin A and the vitamin C are applied and massaged onto the skin. They're left on for a period of 4 to 6 hours, depending on what is the skin type of which is being treated. And then after 4 to 6 hours, the person is asked to wash it off with plain water at home. What do you expect after the treatment? Usually it takes about 2 to 5 days of exfoliation. So there is going to be a shedding of the skin, there's going to be a dryness of the skin is going to be a little flaky and irritated for the next 5 days. So you have to use a soap-free cleanser, a lot of moisturizer, definitely lots and lots of sunscreen. And after the 5th day, the skin comes back to normal. It looks significantly better. Texture improves, and there is a significant glow which happens after the vitamin peel. Are everybody a good candidate for vitamin peel? No, you have to remember that retinol is contraindicated in people who are pregnant and lactating. So they are not allowed to do this treatment. If you are planning a pregnancy, it's a bad idea to do this treatment. And you can also not do it if you have very sensitive skin or if you have very acne prone skin. It may increase or trigger one bout of acne. So who is going to benefit from this? People with very oily skin, people with mature skin, people with lot of post-acne scarring, pigmentation, sun damage are all going to benefit from the vitamin peel treatment. And it is definitely going to give you a significant glow. So if you're planning an event maybe after a month, then it is a time to do a vitamin peel treatment. Know more about vitamin peel treatment, speak to your dermatologist today.